Good evening and welcome to the School District of Lee County's Wellness Wednesday for Parents event. My name is Lori Brooks and I'm the Director of School Counseling and Mental Health Services for the school district. Thank you for spending some time with us this evening, investing in learning for our families. Wellness Wednesday for Parents events are offered monthly in the evening. On the same day, our secondary students engage in school-based wellness instruction through the Student Wellness Wednesday initiative. Each month, the district presents on a different wellness topic. Tonight's topic is depression in youth, signs, symptoms, and what parents can do to help. Our expert presenter is Ms. Georgina Helinski, who is a licensed mental health counselor and the Children's Therapy Services Assistant Manager at Salus Care Incorporated. Before I formally introduce Ms. Helinski, I would like to make a few announcements and also discuss the format for this evening's event. I'm just going to take a moment and pause to make sure that I am recording. Yes, I am. Okay. A lot of our parents would like to view these presentations on demand, so I always like to make sure we have them recorded. Okay, so for your planning pleasure, our next Wellness Wednesday for Parents event is planned for May 26th, and the topic will be building resiliency in children. This is especially important for our families as we head into summer vacation, because it's a time for our children to rest, recharge, and reset, especially after we've completed an unprecedented school year. And parents can really help their children build resiliency and engage in that type of activity and those learning opportunities with their children. So we will send details about the May Wellness Wednesday topic via school messenger as the event draws near. As we turn our attention to this evening's topic, please know that you can enter questions into the Q&A section, and our panelists will address them during that section of the presentation as time permits. So we're in webinar format, and the reason we do that is to allow parents to pose questions in a confidential setting, because when you pose questions in this format, only the panelists can see them. Now you can pose them anonymously or you can use your names, but that's why we use the webinar format. Now, a downside of the webinar format, however, is that all of our microphones are muted and it really kind of minimizes the actual verbal conversation. However, with these types of topics, we wanted parents and family members to feel as if they could ask questions without it being open to all in the chat box. And this way it only comes to the panelists. I would like to keep in mind too that we are recording the presentation so that you can view it later, and that this topic it can be difficult for us. A lot of mental health topics are hard depending on where we each are personally and how we're working with our children or ourselves on some of the mental health topics. In our presentations, we always want to remind our families of the fact that there are resources available for you if you or a loved one is experiencing a mental health emergency or in a crisis state. And so we try to pop this slide up in all of our events to let you know, and you can take a screenshot of it because you never know when you might want to pull that off on your phone and say, I want to give this as a resource to someone. So please take breaks tonight as needed. Our presentation will be actually under an hour, and then we'll have time for Q&A. And always remember to exercise self-care for yourself. It's kind of the oxygen mask theory. We're all taking care of our children, but we also need to make sure that we are taking care of ourselves, put the oxygen mask on ourselves before we put them on our children. Let's see, I think that's about all I need to do except introduce our guest presenter. So it's now my pleasure to introduce tonight's expert presenter. Ms. Georgina Helinski, as I stated earlier, is the licensed mental health counselor and the Children's Therapy Services Assistant Manager at Salus Care Incorporated. Ms. Helinski graduated from the University of Pittsburgh with a BS degree in psychology and then attended Indiana University of Pennsylvania to receive an MA in clinical mental health counseling. Georgina has worked at Salus Care for over 6 years, providing therapy to children, families, and adults for problems related to managing mental health symptoms, behavioral health symptoms, and substance use. Georgina's prior work includes behavioral support and intervention with children and their parents, as well as in-home therapy to families and children who are at risk for out-of-the-home placement. So without further discussion on my end, I would love to turn this over to Georgina so that she can share with you her knowledge this evening in the area of depression in youth. Welcome, Georgina.
Hey, thank you, Lori. Okay, let's get this started. Okay, for some reason, of course, the play button's not working. But yeah, so while I'm trying to get this to work, yeah, my name's Georgina, and I'm from Salus Care and the Assistant Manager of Children's Therapy Services. I think this is great what the school district is doing for parents, because I think these are really important topics that they are bringing up. I'm going to stop share real quick and see if I can get this to work, and then let me reshare. There we go. Okay. So depression in youth, signs, symptoms, and what parents can do to help. So hopefully by the end of this presentation, you'll have a better understanding of the signs of depression in young people, and you'll feel better able to judge typical versus atypical depressive behavior. I hope I can also provide ways that you can help as a parent, and as well as find some resources you can access for your child or for your family. Some of the things I'll be discussing today are in a very general sense. There's some suggestions I might provide, and they work for a lot of children and families, but not necessarily everybody. So if you do seek therapy or some other kind of support, they're really going to make a treatment plan that's specified to your child or family. So I just wanted to make sure, I noted that. And so I just have a couple statistics here I wanted to show you. The main one I wanted to point out is this one in the middle here, about 3 in 4 children aged 3 to 17 years with depression also have anxiety, and then almost 1 in 2 have behavioral problems. The reason I wanted to point that one out is because I think it's really important to understand that so many children with depression have behavioral problems, and that's often what people see first. So I just think that is a really important point, as you're moving forward to think about. So I have a little clip to get us started. I don't know if you've ever seen the movie Inside Out. It's a really cute movie, but actually it does a pretty good job of discussing emotions and explaining them. And so this clip I'm going to show you is a dinner scene where Riley, who's the child here, Joy is missing. And so I want you to pay attention to how the child responds to her parents without Joy there, because sadness is also gone. So joy and sadness aren't there. And then I also want you to pay attention to how her parents respond. And then we'll talk a little bit more about that.
So, as it turns out, the green trash can is not recycling. It's for greens, like compost and eggshells. And the blue one is recycling. And the black one.
Riley is acting so weird. Why is she acting so weird?
What do you expect? All the islands are down.
Joy would know what to do.
That's it. Until she gets back, we just do what Joy would do.
Great idea. Anger, fear, disgust. How are we supposed to be happy?
Hey, Riley, I've got good news. I found a junior hockey league right here in San Francisco, and get this, tryouts are tomorrow after school. What luck, right?
Hockey.
Uh-oh, what do we do?
Guys, here, you pretend to be Joy.
Won't it be great to be back out on the ice?
Oh yeah, that sounds fantastic.
What was that? That wasn't anything like Joy.
Because I'm not Joy?
Yeah, no kidding.
Did you guys pick up on that?
Sure did.
Something's wrong.
Should we ask her?
Let's probe, but keep it subtle so she doesn't notice.
So, how was the first day of school?
She's probing us.
I'm done. You pretend to be Joy.
What? Okay,
It was fine, I guess. I don't know. Oh, very smooth. That was just like Joy.
Something is definitely going on.
She's never acted like this before. What should we do? We're gonna find out what's happening, but we'll need support. Signal the husband.
Ahem.
Uh-oh, she's looking at us. What did she say? What? Sorry, sir. No one was listening.
Is it garbage night? We left the toilet seat up. What? What is it, woman? What?
He's making that stupid face again.
I could strangle him right now.
Signal him again.
Ah, so, Riley, how was school?
You gotta be kidding me.
For this, we gave up that Brazilian helicopter pilot?
Move. I'll be Joy.
School was great, all right?
Riley, is everything okay?
Sir, she just rolled her eyes at us.
What is her deal? All right, make a show of force. I don't want to have to put the foot down.
No, not the foot.
Riley, I do not like this new attitude.
Oh, I'll show you attitude. No. Stay happy.
What is your problem? Just leave me alone.
Sir, reporting high levels of sass.
Take it to DEFCON 2.
You heard that, gentlemen? DEFCON 2.
Listen, young lady, I don't know where this disrespectful attitude came from.
You want a piece of this, Pops? Come and get it.
Yeah, well,
Here it comes. Prepare the foot.
Keys to second position. Ready to launch on your command, sir.
just shut up!
Fire!
That's it. Go to your room. Now.
The foot is down. The foot is down.
Good job, gentlemen. That could have been a disaster.
Well, that was a disaster.
Come, fly with me, Gachinya.
Okay, so I know that was a little bit funny. Hopefully, I think it's funny anyway. But what I wanted you to see here is that, in this case, joy or happiness was gone. And it wasn't just sadness that took over. It was anger, disgust, and fear. And that's sometimes what we see in children when they are depressed. It's not just sadness, it's these other kinds of emotions. And so I want you to keep that in mind, throughout the rest of this presentation. So depression is not one size fits all, especially with children and teens. There's different kinds of depression, and I won't go on a lot about these, but I just think it's important and maybe helpful to understand that it can look very differently. The first here is adjustment. And so that's basically depression that comes from an adjustment in life. This is really common right now due to the pandemic. There's plenty of children and adults that are experiencing depression for the first time, as well as other kinds of things that they've never experienced because of the pandemic. There's also major depressive disorder, which is something that comes in episodes. Sometimes they'll seem fairly normal or what you're used to, and then they might have weeks where, you see this depression. There's persistent depressive disorder, which is really ongoing chronic symptoms that last for at least 1 year in children and teens. There's other mood disorders such as bipolar disorder, and some common co-occurring issues we see with depression, such as the behavioral issues that I showed earlier with some of those statistics, and the anxiety, as well as trauma, ADHD, eating disorder, substance use, medical issues. There are many common co-occurring issues along with depression, and that's in young people and adults. So these are some signs and symptoms. I took most of these from what we call the DSM, which is the big book that helps us identify and diagnose what's going on. So depressed mood, that one's a little more self-explanatory. That's really sad, low mood. Feelings of worthlessness or guilt, poor concentration and low motivation. Irritability, this is especially common with children and teens. In fact, sometimes we see the irritability more so than what we think of as depressed mood, as sadness in young people, kind of like that clip that you just watched. Anhedonia, which just means lack of pleasure or interest in the things that they once enjoyed. Sleep problems, sleeping too little or too much. Change in weight or appetite, overeating or undereating. Thoughts of suicide or death, and self-harm. The thoughts of suicide or death and self-harm, obviously those are some of the more serious symptoms. Things to look out for with thoughts of suicide or death are, sometimes they're more passive, such as, I don't want to wake up tomorrow. I don't want to be here anymore. Or you could hear more direct kinds of thoughts, like I want to die. When that happens, we really want to make sure and check, if they have a plan, means to do that, and intent to do that. And as many of you probably know, last month's Wellness Wednesday session was on suicide prevention, and it has a lot more details about that. So I won't spend too much time on that. And then self-harm. Self-harm is oftentimes not suicidal. It can be, so it's important to assess and try to understand that. And it's also not always attention seeking. That's a really common misconception about self-harm. For many, they self-harm in more hidden areas, and people don't even realize that they're doing it. And as you can see, there are different kinds of self-harm. Many people are aware of the cutting or scratching or burning, but hitting themselves, there's different kinds of ways people might harm themselves. For some, it's an attempt to try to cope with feeling what they might describe as really numb, which is that pretty severe depression. For some, it can feel kind of addicting whenever they harm themselves, and they almost get a rush because they can't really feel much else. And that's something that happens with more severe depression. So obviously, thoughts of suicide or self-harm, it's really important to reach out to somebody if you or your child was experiencing those kinds of symptoms. And so what does that actually look like? Because those were obviously all the diagnostic criteria. So what does that look like when it's your child? So isolating to their room all day. However, we know lots of kids and teenagers especially like to sit in their room all day, right? So we can't just assume right off the bat that means they're depressed. So it's important when we look at this list that we're usually looking for multiple things like this to be going on to start to think that it might be depression. So just being in the room all day, isn't enough to say that they're depressed. But are they sitting in the darkness all day? Are they staying up all night and sleeping all day? Are they watching the same TV show over and over again in the dark? Are they not eating dinner? There's more to it when you see some of that stuff going on. Appearing really flat or numb. Again, some preteens and teens tend to say, whatever, I don't care. But is it looking beyond that? I mean, your child. So if it starts to become really very different, that flatness, that numbness, then that could be a concern. Excessively moody or snappy. Again, this is pretty normal for some preteens or teens, but is it constant? Is it getting worse? Especially if some of these other things are involved along with it. Grades dropping is something that we see whenever kids are depressed. School refusal as well. Aggression, fighting, screaming, hurtful insults, throwing things, punching walls. Sometimes we see that more in boys than girls, but not always. There's plenty of girls that sometimes are, getting into fights and stuff, and that can look like a behavior problem, but it may actually be related to something like depression. Quitting all the things they used to enjoy. And so again, this is a tricky one because especially when we get into the teenage years, they're really, developing their identity. So sometimes teens quit things because they want to try something new. They're just sort of exploring who they are. But if they're quitting things and they are not gaining new interests and just really seem to be just detaching more and more, then that could become a concern. Substance use, again, as much as many of us adults don't want to admit it, teenagers do try things. They experiment sometimes. Not all teenagers, but some do. So just trying something isn't enough to say they're depressed. But if it goes beyond that, if they're using alone frequently, you may want to start asking if they can talk about why. Sometimes some will share that they're using it to cope with the fact that they're feeling depressed or something feels off. And then excessive video gaming, phone usage, etc. Again, this is a tricky one because that's what kids and teens do. They're on their phones and their video games a lot. But are they using it as a way to escape the real world? That's something we try to look for. So depression in the media, it's so important to talk about what kids are watching and doing on their phones and laptops and everything, because it does, influence them in a lot of ways. So try to talk to your kids about what they're watching and reading and who they're interacting with online. But there are a lot of pros and cons. So, for example, the pros for depression and seen in TV shows and movies is that there's more discussion around mental health than ever. And that discussion can help lead to less stigma. And less stigma can mean more people asking for help. A lot of young people are a lot more comfortable than past generations talking about their feelings, and they enjoy therapy or talking to their friends about what's going on. They actually find that helpful, and that can be really beneficial. But of course, the cons to depression in the media is some TV shows and movies and even music. There can be some really graphic discussions about self harm, even in music. There are a lot of artists over the last few years that have, in all kinds of music, whether it's rock or rap, there's more graphic discussions around suicidal thinking, that kind of stuff. So it is important to maybe just get an idea of what they're listening to, what they're watching. Some things appear to glorify self harm sometimes. There's some graphic movies of self harm, of suicide. Some of those things don't always show young people getting help either. And some of them don't show the adults or the professionals in a positive light. Sometimes they make it seem like the adults don't know anything and can't really help them. And that can be kind of a con, because we do want children to know there are some people out there that do want to help and do want to understand. So social media, again, so many pros and cons. Instagram, TikTok, Snapchat, Facebook, and there's so many more. I'm sure there's a new one out there this week that I don't even know yet. They can be fun. They can encourage creativity. They can be a social outlet. I'm sure many of you parents are on some of these apps as well, and they can be a really nice way to connect with people. But of course, there's some cons. Many of these apps can cause some self-esteem issues, which can then result in some symptoms of depression. Filters, if you look at this example on the right here, that filter seems fairly harmless, but there are more and more now that are, excessively lightening skin, for example, are making noses look narrower, faces less round, and all of a sudden they look back in the mirror and they don't see that same filtered face anymore. And so that can really cause some self-esteem issues. And then FOMO, I don't know if anyone knows what that is. It's the fear of missing out. So kids are constantly scrolling through, TikTok and Instagram, and they're seeing all these people traveling and having the best days, with having parties, all of this amazing stuff. And it can make them feel like an outsider or like they're missing out on that stuff. Even though most of us know that stuff isn't real, or, we know they're not showing their normal days or their bad days. For young people, it really can make them feel like they're missing out on things, which again can be a hit to their self-esteem and can make them feel somewhat depressed. It's also easier for kids today to experience more bullying because they're always connected to their peers. So if a kid's being bullied, it could be at school, it could be at baseball, it can be, anywhere. 15, 20 years ago, you could just go home and get away from that for a little bit, hopefully, in many cases. But now it's following them home, right? They go home and they try to log in and, check out some pictures on Instagram or send some Snapchats, and then they're coming at them again. So kids can't get away from that stuff as easily as, many people could years ago. So that's another thing that can greatly affect a child's mental health and possibly influence some depression. However, I do have to have, a note here about technology, especially right now during the COVID-19 pandemic. Phones, video games, and computers are a primary source of communication and connection. And it's not ideal, probably. And that's unfortunate. However, we also don't want kids to be isolated. So it really is trying to find that moderation with this kind of stuff, which is not easy as a parent to do that. So I want you to take a look at some of these images and just notice how you're feeling for a moment. And just kind of sit with that. Some of you may be having a reaction. Some of you are maybe instantly exhausted or annoyed because you're sick of this. Some of you, maybe you're like, oh, I like those too. You're kind of happy. So I want you to hold on to that reaction for a moment, because I am going to come back to that on the next slide. So just keep in mind how you're feeling about these things. So what can you do? prevention and treating mild symptoms. So it's important to note that sometimes depression is not fully preventable. Sometimes it is genetic. So you can't necessarily prevent something genetic, but you can, in many cases, do things that can lessen the severity. So, some of these things are a place to start. So try to communicate and listen. This is hard because as parents, you want to often perhaps fix or correct things because you love your kid and you don't want them to feel the kind of pain they're feeling when they come and share some of these tough things with you. However, some kids want to be listened to first. They want empathy, they want validation for how they're feeling before they get to the fixing or before you get to the fixing. That helps them know it's safe to just come and tell you how they're feeling. So, try to work on that listening part of the communication. Try not to get defensive or minimize their feelings. Sometimes, some parents can personalize things and assume that if they did everything right, how could their child be depressed? So that might make them inclined to ignore it or minimize it or think, they might be just being dramatic. And sure, kids and teens can be dramatic, like, of course, but try not to say that to them. Sometimes kids may act out more to be believed, in fact. So it's important to try not to minimize, whatever they're telling you about how they're feeling. And then try to pay attention to your nonverbal language. When they do come to talk to you about important things, do you remember to put the stuff down that you're working on? You're busy and kids are really good at finding really inconvenient times to want to talk to you about important things. So it can be really easy to continue doing the dishes or, playing the game or looking at your phone or watching TV. And you might think, you can get to it later or something. But they're paying attention to not just what you're saying, but also if you appear like you're listening. So, did you put it down, whatever you were working on? Did you make eye contact with them? Try to remember what your body language and your nonverbal language is saying to them. That can really make a big difference. Try to take a step back and focus on the need rather than the behavior. Now, again, this can be really tricky because if your child is having behavioral problems, if they're yelling at you, if they're following you around and being pretty irritating, you might want to lock yourself in your room or yell at them or discipline them because it's really frustrating. But maybe consider, trying a little experiment where you try to stop before you respond and ask yourself, what do they need right now? Could that possibly change how you respond to them? And could that possibly change how they respond to you? That's kind of related to that Inside Out clip that I showed you earlier, right? Riley's parents didn't do anything wrong. They were just doing what they normally do as parents. But now they have a kid who's feeling kind of depressed and she went through this big change in her life. And so she's different than she was, maybe a few months ago. So the way that they normally did things didn't quite work in that moment. So, this is an opportunity where, you might want to try some different things if your kid is seeming depressed or like you're struggling, to get through to them. And sometimes kids can be testing you, especially when they have low self-esteem or they're feeling unloved, which is very common in kids with depression. Some other things you can do is help them keep a routine. Just your regular getting up in the morning, having lunch, having dinner, just doing homework time, bedtime, regular routine, spending time together. And I don't mean going out and spending a bunch of money doing things. You don't have to do that. It's those regular time things of like having dinner together, playing a game, watching a movie, going to the park. You don't have to spend a bunch of money to have bonding time with your child. And then taking interest in their interests. So remember that slide I just showed you? If you instantly felt annoyed or some disgust looking at, Fortnite or Roblox or TikTok or anything like that, your child may know that by now, and they may quit coming to you to talk about those things. And sometimes eventually parents start asking, well, why don't they come and talk to me about anything? Well, if they felt rejected over and over again, sometimes then it makes it hard for them to go back to you to try again later. So you don't have to be on your game 100% of the time because you're busy and you have a lot going on, but try to take that time to take interest in their interests and remember your nonverbal communication, that you're looking at them, you're letting them feel like they matter in that moment. And so what are some other things you can do? Encourage a nutritious diet and exercise. This can help some mild symptoms of depression, but also don't obsess over it. I say that because if somebody's already depressed and they're not feeling great about themselves and you obsess over it, this could result in more negative thinking and an increase in depression. So if you do think that their diet or lack of exercise or overexercise, even in some cases, is a problem and you have health concerns, then of course talk to a doctor about it. But in general, encourage it, but try not to obsess over it. Instead, you can try to help them set small, manageable goals. Small successes feel really good and can be very motivating. So rather than saying you need to start going outside, you need to get back into soccer or baseball or this or that, if they're pretty depressed, can you start with, can we go outside for a walk a couple times a week for 45 minutes just to get some sunshine, just to get moving? Start a little bit smaller and see if that is more doable for them. Sleep hygiene. So sleep is tough, right? Because kids, especially preteens and teens, they start really just having wacky sleep schedules eventually, right? And we know teenagers, especially, I mean, there's research that shows they're already wired to sleep longer and later into the day than adults and little kids are. So honestly, part of it's really not their fault, as frustrating as it can be. So try to help them maybe create a bedtime routine that helps them just feel a little bit more relaxed. Encourage them to get up at a reasonable time and get their day started. But of course, be realistic. If your child has to get up at 5 a.m., to catch the bus because they have a long bus ride to school or something, and they're going to bed at 3 a.m., you might want to start with, can we get to bed maybe by midnight? Of course, we'd love them to get to bed by 9 because then they'll actually get 8 hours of sleep, and that would be wonderful. But a kid going to bed at 3 or staying up all night and then making them go to bed at 9, it's just not going to happen in most cases. You could try, but it's probably going to end up in a lot of frustration. So be realistic, start smaller, and set those manageable goals. And then just another point about self-harm. Disciplining for self-harm is rarely effective. Sometimes, parents know that discipline, consequences work for other things. So sometimes they try to use that kind of mindset for something like self-harm. But if you start disciplining self-harm, it can start to cause more shame and guilt, which can then trigger more self-harm and possibly more secretive and hidden self-harm, which then can become more dangerous. And when someone is self-harming, safety is really the first priority. And it can be really upsetting to see that your child may have cut themselves or hurt themselves. However, when they start hiding it, we're becoming more concerned. We're more worried about their safety. So instead of disciplining, try to keep an open line of communication. Try to be caring rather than judgmental. And then, let them know that you value their life. And in this case, you may want to consider some treatment options, which of course I'll talk more about shortly. For example, in therapy, we help them to develop skills to, hope ideally eventually stop self-harming. But usually what works best is when that child or teenager or adult finds their own motivation. We also can work on safety planning and different things like that. But there's lots of skill building that goes into stopping self-harm in many cases. So who to reach out to if symptoms worsen or you're just unsure, you don't know where to start. So a great place for you to start is the school. As you can see, Lee County does really care. They're doing more mental health outreach in the school. They're holding these Wellness Wednesdays for parents. The school district has, school counselors, school social workers, the licensed mental health professional team, and the mental health team actually can provide some lower level of counseling at school as a place to get started. So if you're not sure if they need to see therapy, formally outside of school, weekly, that kind of stuff, start with the school and they can start providing some lower level counseling. And in that process, they can assess them your child a little bit further to see if perhaps they need something a little bit more outside of school as well. Even if you start with the teacher, if you feel comfortable with your child's teacher, they can then help connect you with these other individuals at the school to help your child get what they need. Another person you can talk to is your child's pediatrician. The pediatricians now, almost all of them are doing some screenings. It seems like that helps screen for depressive symptoms. It's becoming more and more common. So the pediatrician should be able to help. You can also request that they roll out some medical issues first. Thyroid issues, autoimmune disorders. There's many things that mimic mental health that are actually physical health symptoms. So you absolutely consider starting with the pediatrician first if you're seeing, that low mood, that irritability, the difficulty focusing, that can be in line with some other medical things. And then if you try some of these other steps and you need a little bit more, you can absolutely look into therapy. Therapy can consist of individual therapy, group therapy, family therapy. I listed a few different kinds of therapy that we use with young people. The reason I listed those is because honestly, you can do a Google search to learn a little bit about CBT, DBT. That's cognitive behavioral therapy, dialectical behavioral therapy. Those are big clinical words, but basically, if you do a Google search, you can find a lot of free, helpful resources about these kinds of things to see if that sounds like something you'd be interested in, your child, participating in. I have the family systems there. Remember that clip from Inside Out that I showed you earlier? That's why we recommend family therapy, because oftentimes parents, again, they're not doing anything wrong. It's just that unique children or unique situations sometimes require unique solutions. So a child that's depressed might need something different than a child that's not depressed. And it's not about what's right or wrong. It's just different. So that's why family therapy often plays a huge part in helping a child who is depressed. And then group therapy at Salus Care, we have groups. They're still over Zoom currently because of the pandemic, but we have a grades 3 through 5 group, a girl power group for girls 11 to 14, and a co-ed teen group. We're always looking to add more groups if there's an interest. It's something we love developing. I love developing groups. So if there's enough of a need, we want to get it started. So group therapy can be great because it helps them not feel so alone in what they're experiencing. Regardless of the kind of therapy, is your child comfortable? So your child doesn't have to love their therapist or think they're the most amazing person they've ever met. That's not at all what this means. But your child does have to think, well, maybe this person can do something for me. And they can be even a little ambivalent. Ambivalence is not bad. Being in the middle can be okay. A lot of kids start there, and that's fine. But if they absolutely think the person is the worst person in the world and are refusing to get in the car, you might want to try calling someone, like, another therapist, or ask for a referral. There might be someone else out there that's a better fit. As professionals, whether we're talking therapists or psychiatrists or psychologists, we all know that we don't click with everybody. So it's perfectly normal to transfer people sometimes, and that's okay. And then, of course, I have on here as well psychiatry or medication. So in some cases, we do consider psychiatry or medication and would make a referral to consider that, especially for the more moderate and severe forms of depression. Medication can truly be a benefit. They even have testing now to help narrow down the best medication. It's called gene site testing. Many insurances do pay for it or pay for part of it now. So if you're kind of on the fence about medication, or you're scared of your child having to try a bunch of different ones, but you think that's a route you want to go, you can ask your doctor for that testing. And then, of course, it's okay to get your own support. This is so important as a parent. Parenting is hard, period. But then parenting a child who is depressed or is really struggling is extra hard, right? So it is okay to get your own support and consider your own, whether it's therapy or support groups. So how to get help. So there's a couple different ways, and I'm going to talk a little bit about, how you can get services at Salus Care. We have an agreement with Lee County School District to help get your kids in quicker. So one option is the individual student referral. So Say Less Care has 2 clinicians whose role is to process and assess kids referred from the school district. They can often get them in pretty quickly. Of course, it depends on, the family schedule and, to accommodate that, but they can often get the kids in pretty quickly, sometimes within a few days, and then do an intake assessment to help them find the best level of care and get them assigned to a therapist or a doctor, whatever seems appropriate at the time. The intake assessment is free, but for the individual student referral after that, therapy is either billed to insurance, or you can talk to the financial counselors if your child does not have health insurance. Say Less Care sees plenty of people without health insurance and works on payment plans and sliding scale and different options. So if anybody's concerned about that, the intake assessment is free, and then you can call and talk to a financial counselor to learn a little bit about costs and everything. And then another option that the school district can help connect you to is the Community Family Response Team. So this is a new service that just started within the last several months as a response to the pandemic. So families that have been affected by the COVID-19 pandemic, whether that's emotionally, financially, increased substance use, increased conflict, anything like that, you may qualify for this program, more or less. You could just, again, talk to somebody at the school about it if you're interested. We call it CFIRT, the Community Family Response Team. A CFIRT includes a family clinician and a resource specialist. And the idea is, the purpose is to help families get back to their level of functioning pre-COVID. This program is family focused, so it's not just the child focused. It's really about involving the whole family, or at least the parents and the child. And that part of it's really important. And this is completely free to the family. We do not bill insurance. We do not send you a bill. This is completely free to the family if you are participating in the Community Family Response Team. Again, you just would have to ask the school and let them know what's going on, and they can make a referral for that program to Say Less Care, and then someone would call you. This is not, like I said, it's not just for the child either. If you as a parent or your spouse or someone else in the household has had any of those issues related to the pandemic, emotional, financial, increased substance use, conflict, increased mental health symptoms, that also qualifies your family to participate in this program. So please reach out to the school for either one of those if you think it may be something that could help you. There's also our website, saylesscareflorida.org, has all our services listed there. There's also a link there, contact us link, and forms and important links. If you go there, you can put a referral in there or request someone to contact you. However, if you want to get your child involved, truly the best way to do it is to go through the school district. Again, the intake assessment is free. That's also the phone number for our Welcome Center, who's available Monday through Friday, 8 to 5. And then our emergency services line. This is a 24/7 line. However, if it's a life-threatening situation, please call 911. And then finally, our last slide, just a couple other resources. If you as a parent are looking for some of your own support, Say Less Care has a free Zoom parent group run by Laura, who is one of our therapists here at Say Less Care. This group is Mondays at 7 p.m. And there's the Zoom ID and password. You do not have to be a patient of Say Less Care. Any parent in the community can just log in Monday at 7 o'clock into Zoom using that ID and password and connect to the group. If you aren't able to screenshot this or lose this, please ask Lori and Sherry. I did send them a copy of the flyer, so they can send you the flyer. Make sure you have this if for some reason you lose it today. But this is a wonderful, free, totally free opportunity for you to get some support if you're looking for a little bit of support. And then, of course, Lori shared some of this stuff before I got started. The Mobile Crisis Response Team is 24/7. And there's a couple other things. SAMHSA has a 24/7 national helpline, kidshealth.org, CDC, National Suicide Prevention Lifeline. The crisis text line, that's a great resource because a lot of people are more comfortable texting rather than calling. So you can absolutely use that if you would prefer to text. And if you're comfortable sharing it, with your teenager or something, that is something you could share with them. And then of course, NAMI. NAMI, that link there will take you to their list of resources, but you can also just Google search NAMI Lee County. NAMI is the National Alliance for Mental Illness. Tons and tons and tons of resources through them. And NAMILee.org is the local Lee County branch of NAMI. So that is all for me today. So now I think we can open it up to some Q&A.
Georgina, thank you so very much for your presentation and for sharing this information. Your presentation was really packed with excellent tips and strategies for parents, which is one of the reasons why we record these. And it will take a day or two to post, but we will have those typically on our YouTube channel for on-demand viewing. Because parents will probably want to revisit this and capture this slide information. And so parents and attendees, if you can give us just a few days, we'll have that posted on our school district YouTube channel. We'll have this recording. And also, please, now is the time to go ahead and enter your questions in the Q&A section. And we will be happy. I have staff members that are on here as panelists as well, Sherry Wenzel and Mary Lynn Rodriguez, and they'll turn their cameras on. And we'll be happy to answer questions for the district perspective. And also Georgina will answer from her clinical experience and also from Salus Care's perspective. Before we go to Q&A, I wanted to just mention a couple of things Georgina touched on in her presentation. Every one of our schools has a school mental health team. And that is made up of, and thank you for covering that, Georgina, school counselors, the school social worker, school psychologist, and a licensed mental health professional. And also our school nurses assist on that team, because a lot of times when students present in the clinic, there may be some additional things going on. I want to be clear that for mental health, and the teamwork, when we have a concern about your child, you are right at the pinnacle of that process. That would be a phone call and outreach to you as the parent, guardian, or caregiver with those concerns to ask if you're having concerns. And then we would ask for your consent to move forward with any additional screeners, et cetera. And without consent, we don't do mental health without consent. And I think that's really important for our parents and guardians to know. Now, the school counselor, social worker, we have a lot to those jobs that also support students, and not everything is a mental health concern. And wellness is really at the center of where we need to be in our work with children, but sometimes we need more. And that's where the wellness piece comes in. But I just want our parents to know that you need to be part of that process, and your consent moves that forward. If you would prefer not to have the school involved, we understand entirely. We're happy to give you resources, et cetera. And you can also find things on your own through your insurance access. But we are big believers in we are here for children, and we want to honor and respect that and help you because you send your precious babies to school, and we want to assist in that, but keep parents at the center of our work as well with our children. So having said that, hopefully I talked long enough because people started typing questions into our Q&A box, so my strategy worked. And one more thing, our CFERT teams really were such a win for our community. And through the CARES Act funding, we were able to partner with Salus Care, and we're very grateful for those community family response teams for rapid response with COVID stressors. And that was just really an amazing partnership for our families. And so we want to publicly thank Salus Care for engaging with us in this endeavor. All right. So Regina, you've probably been reviewing the Q&A box, have you?
I've seen some of them popping up. I just stopped sharing my screen because it's a little bit easier to get to them. But yeah, so there's some good questions coming in.
Yes, so I'm going to mute and let you direct that, and
Yeah.
you can just tell us when you want us to chime in.
Sure. So do you have a teen support group? Somebody asked. So we have teen group therapy. We don't have one of those community support groups like we do for the parents right now. as you know, Lori was mentioning things about consent and different things. You know, there's some stuff that is a little bit different when it comes to children and teens. There may be some things going on though over Zoom that are happening in the community. So if you're looking for something like that, if you reach out, you know, to Lori or Sherry, you can even reach out to me, Lori and Sherry, if somebody specifically asks you, because I can do a little bit of research, because I get flyers and things coming in for things that might not be a support group, but are for youth that are happening over Zoom and stuff right now. So we might be able to connect you to some stuff like that is maybe supportive for, you know, young people. But we do have group therapy. So the difference in the group therapy is you have to be a patient at Salus Care. You can do that through a referral from the school district though. And you can even identify you only want group right now. You don't want to do, you know, individual counseling or any, you know, that kind of stuff. So what you can do is just have them send over a referral. Like I said earlier, we have group therapy for kids in grades 3 through 5 is one group that we're running right now. We have another group, it's the Girl Power group for girls ages 11 to 14. So that's another group therapy that we're doing right now. And then we have a co-ed teen group as well that we are running, and those are all over Zoom. So again, you can just ask for a referral to be sent over from Lori and Sherry and fill out all that paperwork and everything if you think that you would like your child to try to get involved in something like that.
And Georgina, just to add on to that, we within Lee County Schools are offering what we call our CBITS groups, which are cognitive behavior intervention for trauma in schools. And we are really trying to engage our students and our families in those groups. Those groups also do have a parent component with them. And so parents, our schools are slowly kind of with testing and stuff, we're trying to get those groups up and running. So if you feel that your student would benefit from that, please reach out to your student's school social worker, school counselor, school psychologist, and they'll be happy to let you know if those groups are available currently at your school or when they are projected to be offered. So, you know, we are also trying to offer some of those groups within our school system as well.
One of the things you're going to notice tonight is we have systems of care available with our community partners and also through the schools. Sherry Wenzel is our mental health coordinator, and Mary Lynn Rodriguez is also one of our coordinators as well in school counseling and mental health. And I was remiss in not actually introducing both of you. And what Sherry is talking about too is we have these groups that we don't have to do them during school hours. Our parents can sign their students up if they're interested through our school mental health teams. They can sign their student up to do this after hours, and we're going to continue offering them over the summer as well. We can do them via Zoom. Of course, like Sherry said, parental consent. There's a parent component to help you support your child through symptoms of anxiety or depression. And let's face it, we've all had a level of trauma with this pandemic. And so if you're interested in these particular school-based groups, or if you're interested in the opportunities Georgina has provided through Salus Care, just know you've got opportunities, and we can serve those needs even during the summer as well through the school-based CBITS groups. So we're going to give you a lot of information tonight. And I think really the one takeaway, if we can provide you with, is where do I go if I have more questions after tonight? And you heard Sherry and Georgina talk about your school counselor, social worker, a licensed mental health professional at your school. And school counselors are at their schools 5 days a week. And I want to address something about school counselors too, because I do see a question, and it's a good question, like what would be my next step as a parent if our school counselor is not really able to help with my child's needs? And we know, and you know too, that our numbers are few and the students are great. However, if that were to happen to you, We want you to talk to the assistant principal. You can call myself or you can call Sherry Wenzel. We're here at the district office, or Mary Lynn, and we will help ensure you get that connection and that level of service. Because sometimes, especially with COVID and with the number of kids we have at home on Lee Home Connect and in the building, this year has been a challenge for our school mental health professionals sometimes to keep up with timely response, and that's not an excuse. It's just right now the reality we're in. We don't ever want a parent sitting out there feeling like they didn't get what they needed. So again, my name's Lori Brooks. You got your webinar invitation from me. My email is on it, Sherry Wenzel, Mary Lynn Rodriguez. We will make sure that we help connect you for a more thorough and timely response at your school if you are struggling to get that supportive response.
I saw another great question coming in here about the one type of testing I mentioned, gene site testing. So Gene, like genetics, gene site, SITE. You can do a Google search and actually find a little bit about the gene site testing. So what that testing is you can request it from your doctor. I think the pediatrician could do it, or they'll do a referral to a psychiatrist. And basically that testing it's basically genetic testing to show what kind of medication someone may best respond to, which is pretty incredible when you think about it, because, not so long ago, it did feel, like people had to try different things first to find the right kind of medication. But this is an option for children and adults now that helps eliminate, in some cases, that having to switch different meds to try to get the right one and stuff. So gene site testing, ask your doctor or your child's doctor about it, and they can order that testing if you would want to be if you were interested. And like I said, some insurances are either paying for it or paying for part of it. So of course you'd have to reach out to your insurance company too, but it is a great option if you're considering medication for you or your child. There's another one here, but I'll start, and then of course anybody else can kind of chime in about explaining depression in a teen sibling to younger siblings. That's a really great question. And, I think it's tough to give a really specific answer because there's so much involved with some of those discussions, at least for me, because I'm someone that's really a big proponent, like I said, for family therapy and assisting in those kinds of discussions with the family. But a place to start could be comparing it to other kinds of medical issues that kids are a little bit more comfortable with or understand, and just help them know it's kind of like that. They need to get some help or some treatment for it. Something like we talk about, diabetes, for example, and how people need medication to treat that. And it's just a condition they have. It's nobody's fault. It's just a medical condition, and they take medicine for it, and it helps them. So sometimes that's a place to start to let them know this is something that, is really hard for their older sibling, and they might need some help to get through it, through medication, through talking to someone. And like I said, it's kind of hard to give a really thorough explanation without, of course, knowing all the details, which this is not the setting for that. But I think that's a really good question. I wonder if anybody else has any thoughts on that.
No, I think that you did a great job of explaining it, and just really depending, like you said, on the ages of the younger siblings. When we're talking about, not toddlers, but like kindergarten, first grade, like just using those very simple words to kind of and make that connection for them, for a little bit of empathy, what it is when they feel sad, and just using those kinds of words. And also, there are a lot of really good, like you could go to the library and children's books on sadness and depression. So if you really wanted to get a book, maybe a children's book from the library that kind of addressed that and read it to the younger siblings, that might be helpful as well.
One other resource that I think sometimes is underutilized in our community is NAMI, because they have a lot of resources for support and for individuals that are also supportive caregivers, whether you're a parent or you're a spouse or a sibling of an individual that's struggling with depression or another mental health challenge, NAMI as an organization has a lot of supportive resources and also groups just to talk through things and get ideas as well.
Yeah. So this was a really good question as well. Another one that there, with more specific information at some point, I might be able to be more helpful, but we'll try to go over it generally. What's your advice on balancing electronics usage when your teenager claims it's the best way to keep in touch with friends and they become depressed when you take it away? Yes, we've probably all heard that one a few times, and there may be some legitimacy to that. So I do want to say that it's like removing a limb from some teenagers, right? That phone is everything to them, and that's their almost all of their social connections, especially right now. So they may truly feel pretty depressed when you take it away. So sometimes just an idea that I share with some parents is, can you start with limitations on it? So rather than fully taking it away, can you start with just letting them have it in small doses or earning it in small doses even? So because perhaps people are taking it away because they're getting into trouble or they're on it constantly. So instead of, you could try setting up a limit. If you get everything done today, XYZ, you get your phone for an hour after dinner or after you do your homework, but then we're going to take it away at bedtime because you're on it till 3 a.m. for the last 3 weeks, and letting them earn that trust back with it. That's just a really general example, but that's sometimes something that I suggest with some parents.
I think we have only one more question at this point, and I think this is going to be one that you can answer from an agency perspective. It says, do you want to, you go ahead. It's okay. Please do.
So someone was asking if there's a charge for group therapy, and they ask if the child's already with another therapist, and they ask about someone that's 18. So I'm going to answer kind of both of those questions. For someone that's an 18-year-old senior, yeah, we'll try to get them into the teen group. We've been able to do that before. We do offer adult groups, and some 18-year-olds might actually prefer an adult group, and that's okay, but that's something that could be discussed during that intake appointment. And then, is there a charge for group therapy? Honestly, that's going to depend on your insurance, or if you don't have insurance, then you can talk to the financial people at Salus Care, and they can discuss if there's a cost or not, and what that looks like. So it depends. And then if they're already with another therapist. So again, that depends on your insurance when it comes to group. For individual therapy, and I know you didn't specifically ask this, but I feel like it's a good time to make this point. You really don't really want two therapists for your child for individual therapy. Unless one's a specialist, sometimes there's a specialist for substance use or for, PTSD or something like that. Then sometimes, as long as they're doing completely different things, or a family therapist versus an individual therapist. But for group, that's okay. That's different. So there may still be a charge, but again, it depends on your insurance company and stuff. So it's kind of tough to answer that question beyond that.
Thank you. And we have a question from a teacher in a behavior intervention class. Thank you so much. If our educators on here too, thank you for joining us, because this is for you as educators as much as it is for parents as well and community members. But our teacher from the behavior intervention class is asking if we have any materials or suggestions that can be infused into this individual's classroom. So we, as a district, we have some materials that can be infused. And I think what I would do is encourage you to reach out to us directly, and we can talk through some of the tools we have as a district and some of the approaches. And that's from foundational social emotional learning all the way through intervention pieces. In addition, though, Sherry, Mary Lynn, do you have anything from the district perspective? And then I think we could ask Georgina too, from a therapeutic perspective, if there are any resources to offer. Did I miss anything from the district perspective?
The only other thing that I can add, Lori, just like as you were stating, we have social emotional learning curriculum that we can offer depending on the grade level that you're speaking of. But you're welcome to contact me directly, and then I can connect you with those resources. We do have second step curriculum available for elementary and middle school, paper-based, that we can offer as our social emotional learning, which is very universal, but can also be used in a targeted manner for, like your other school-based mental health professionals can use it to target specific smaller groups.
Which is great in our classrooms, especially with the behavior intervention class. We're really helping students understand different emotions, what they look like, what they feel like when they experience each emotion, and then how to try to develop appropriate responses. And then, as Mary Lynn stated, and I want to remind you too, for our teacher, that it's Mary Lynn Rodriguez. If you would like to email her, reach out to her. And then for kids that need more, we have some social skills building small groups. And that's what Mary Lynn was referring to, where the school counselor, social worker, and that's not necessarily mental health. It's just what we call psychoeducational. It's additional learning about emotions and feelings. Those are pieces that we can assist, and your school counselor can assist with kids that might need more learning. And we target that learning to the students that need those gaps filled and opportunities to be in maybe a small group or additional instruction to help them develop those skills and those responses. Well, I don't see any other questions. I know we've all been scrolling through to make sure we didn't miss any. I'm going to take one more peek. And I do not see anything. Those of you who made some comments to us about this being great information, thank you so much. That feedback is important. And any other questions you have, please keep in mind that we can certainly provide answers to them. In addition, your schools stand ready to assist you. And I want to go back to that one question, that if you did not get the level of support that you anticipated or timely response from your school, please do reach back out. And in addition, we're happy to assist you and connect you more appropriately to someone who can respond to you if you feel as if you're struggling to get that level of response. So having no other questions posed into the Q&A box, I'd like to, on behalf of the school district, thank you, Georgina Holinsky, for being our guest presenter tonight and sharing your experiences with us. Our community and our schools, I speak firsthand with our partnership, are very blessed to have your services with our youth in a clinical setting. And we really appreciate our partnership, and thank you for spending time with us. And also to our attendees, thank you for spending your evening with us. And we appreciate your time and attention.
Yeah, thank you, everybody. This is so great what you're all doing for parents and for the school. So thank you.
Thank you. Please join us. Let me review that date, May 26th, Building Resiliency in Children. And that will be with Dr. Jason Sabo from Golisano Pediatric Behavioral Health. And he will be our expert presenter that evening. So please look for an announcement for May 26th. Everyone have a safe evening and take care. Thank you.